Okay, so Minister, the first day of your Flu Express, and my goodness, a resounding success.
Absolutely. I think the message has been received loud and clear. I just heard from one of the nurses in charge here, and they said normally on the first day, by 2 o'clock, by the end of the day, they have approximately 400 people. By 11:30, they had over 500 people lined up and who have already completed the test. And you can see the traffic's lined up as far east and west as we can see. So it's good. People are listening and they got the message across. So that's good.
I've interviewed a bunch of doctors, and they've said, a little bit shocking to me, that you can get COVID and the flu at the same time, and they don't know what that looks like. So that's a really big concern.
Absolutely, that's a very scary prospect to have both of them are respiratory illnesses, and to have them both simultaneously could be very devastating, particularly for persons that have other comorbidities and other types of medical conditions. The great thing about the flu shot is that it's highly effective. There's very minimal side effects. It would allow anybody that potentially gets the flu to have very minimal symptoms and to be able to recover a lot quicker, which will, of course, help with our overall system, so we're not having an adverse impact on the health system with people with influenza.
The pandemic is having what they're calling the second surge in Europe, and particularly the UK and certainly the US.
Right.
What are your concerns for Bermuda? Do you think the testing is enough to keep it under control here, or do you think inevitably we're going to see a surge in cases?
I think that with the mitigants that have been put in place by the government, in particular the testing, that we will be able to help to curtail that. We have such a high standard of testing at our borders, so we have a preventative measure there at the borders with respect to surveillance. So persons that are coming that are non-residents have to have a pre-test prior, a negative PCR test prior to arrival, which helps to minimize the impact of the potential of transmission through importation through the borders. So I think with respect to our testing regime, though a lot of people do think it's somewhat aggressive and perhaps they rule against it because they think that it's too aggressive, but it's helping to keep us safe. And that's why we're seeing real-time reproduction numbers of less than one.
A message this morning about the case that was announced last night, that it was actually a visitor that was picked up on day 8.
Right.
Would they have been pre-tested, or any idea how that passenger, was clear all the way up into the 8th test?
Yes, they would have been pre-tested because only anybody that's arriving that's a non-resident of Bermuda has to have a pre-test. Then they, of course, test upon arrival as well as test day 4. And as you rightly said, they did test positive on day 8. However, you've heard us speak about the incubation period, which could be up to 14 days.